Hey, what is going on, everybody? This is the Trading Chief, and I first want to start off this video with I made this video that you're looking at here a couple of days ago, 7 days ago, and it was about ticker RETA or RIATA, um, and I just want to show you that in the after hours yesterday, it ran 185% on its FDA approval. So if you, I mean, let's be honest, not a whole lot of people see my video. It's only got 25 views. I got a small account. But if you got into this play, I just want to say congratulations, and I'm happy for you. Thank you for, uh, you know, watching my videos. Um, but yeah, I'm making this video because I've got a therapeutics company that's going up for an FDA review in mid-March that I'm very bullish on. And back in January, myself and many members of the Banking with Billy Discord group swung this ticker for 30% gains, and that was just on the new drug application approval that went through the FDA and was approved with a 14-1 vote. And that ticker is CDTX, which we can see right here. And it's Cidara Therapeutics is developing a long-acting therapeutics designed to improve the standard of care for patients facing serious diseases. The company portfolio comprises new approaches aimed at transforming existing treatment and prevention paradigm, including drug FC conjugates from its proprietary Cloudbreak platform targeting uh, oncologic and viral diseases. In addition to its phase 3 antifungal candidate rezafungin, Cidara. What's it? Let's look at this real quick. If we go to the Cidara website, we can read. Cidara is developing a novel once weekly echinocandin rezafungin for both the treatment and prevention of serious. Oh, I'm sorry, I wanted to read this one. Rezafungin is a member of the echinocandin class of drugs. Echinocandins are considered the safest antifungal drugs available and are suggested by the Infectious Disease Society of America. As first-line treatment for fungal infections, rezafungin structure and proprietaries have been precisely refined to retain the safety benefits of echinocandin drugs while enhancing its pharmacokinetic and pharmacodynamic properties to create a long-lasting next-generation treatment and preventative capable of addressing even drug-resistant species. Oh, goodness. And as you can see, the CDC has put these threat levels in. They're specifically looking at Canada, this one. Let's look at the treatment, which I clicked off of a minute ago. Cidara is developing a novel once-weekly echinocandin rezafungin for both the treatment and prevention of serious fungal infections such as Candidemia and invasive Candidiasis. The structure and properties of rezafungin are specifically designed to improve upon a clinically validated mechanism, enhancing its efficiency and safety potential for patients. Over 90% of invasive fungal infections begin in the hospital. Infections caused by the Candida fungus, Candidemia, which is a bloodstream infection. Most people that go into the hospital end up dying not because what they came in for, but infections that they gain that they get while in the hospital, and most of them are fungal diseases, are fungal infections that doctors think is a bacteria problem prior to them. No, they'll go through all the bacteria results and blood testing before they'll figure out and rule out that it's not a bacteria, and then they'll go into a fungal. And a lot of people die before that happens. Um, so, uh, bloodstream infection and invasive candidiasis, focal infection localized to an organ. Compromise the majority of these invasive fungal infections. Unfortunately, high rates of morbidity and mortality on top of high medical costs are associated with invasive candida infections. Today's treatments for invasive fungal diseases, including pollines and azoles, and currently approved echinocandins, have significant limitations. Toxicities, drug interactions, low or variable exposure, daily intravenous administration, and increasing resistance to treatments are all issues that that can complicate therapy in patients who are already clinically complex and very ill. And then if we look at their little flow chart, it's actually kind of interesting. Um, a patient is treated in the hospital for a condition unrelated to an infection. That's what I was talking about. They come in and then they end up getting an infection. The patient shows signs of infection. This is particularly concerning if the patient is immunocompromised. Often the infection is assumed to be bacterial in nature, which I talked about a minute ago, and the patient is treated with antibiotics while laboratory tests can test for confirmation are conducted, requiring approximately 24 hours for tests. Most often, doctors do not suspect a fungal infection until a bacterial infection has been ruled out. Doctors now have two common options for treatment: a once daily echinocandin or a once daily azole. Guidelines suggest patients should be treated with echinocandins as a first line treatment. However, this decision will depend on the many factors related to the patient. Both treatment options have significant limitations, suggesting high unmet medical need. That's a mouthful. Patients is described an echinocandin antifungal drug. Currently marketed echinocandins require daily intravenous administration, which may lead to extended, costly hospital stays and increased risk of additional infections. There is also a potential for underdosing or underexposure, which may lead to resistance. Patients is described a daily azole antifungal. Azoles have been shown to be inferior to echinocandins for the treatment of candidemia and have significant toxicities, drug interactions, and low or variable exposures. Cidara's solution is rezafungin. Rezafungin has the potential to be the first line broad spectrum treatment administered once weekly for the treatment of candidemia and invasive candidiasis. This novel molecule and the echinocandin class of antifungals ultimately could lead to improved clearance of infection, shorter and less costly hospital stays, cost effective and easier outpatient administration, and ultimately better overall outcomes. Rezafungin's high plasma exposure and extended half-life allows for front-loaded, once-weekly intravenous dosing to treat Candida infections, including those caused by drug-resistant species. This confers a significant advantage for patients and physicians compared to currently approved echinocandins administered IV once daily. So, you can go to their website and look this stuff up. I'm not going to read everything on here. I mean, I know I just read most of it, but I mean, there's still more stuff on this. As you can see, it's in their pipeline. It's already been NDA filed and approved, which is what I was telling you that I swung earlier, and we picked up 30% gains off of that back in January, and it is now coming up for FDA approval on March 22nd, and we'll look at that right here. I'll show you. The CDTX currently, as of after hours trading, closed at $1.55. I just want to go back to it's on the upswing. So all right, let's look at the news. I had to go back to this news article from January 25th to find the FDA, but it says Cidara Therapeutics FDA decision expected by PDUFA. That's the shoot, I remember what this means, but I don't remember now. It's something drug free, whatever. Anyway, that's the date that they're supposed to approve the drug. Target action date of March 22nd, 2023. But this is worded weird, right? Because this is expected, and every time the keyword is expected, and every time that word's been listed, the FDA generally approves it a week prior to that date. So I just want to put that out there, that don't be surprised if this. Let me look at the calendar. My calendar. It's not gonna pull up on this screen, but don't be surprised if this gets approved on March. I'm gonna say March 17th, which would be about 5 days before it's supposed to be. So, yeah, let's see. I mean, all I can say is, if you enjoyed this content, please come over to the Banking with Billy Discord. Come hang out with us. You know, I post this stuff in the Discord many hours before I make videos on it. It's just between writing out scripts and recording and everything else, it takes me a while because a lot of times I gotta wait on my baby to go to sleep before I can do anything. So yeah, please come jump in the Banking with Billy Discord. Upgrade your membership. It costs $5, man. I promise you, your very first trade with us, you will make that $5 back. We're probably the cheapest Discord that you'll find that has everything that we have. I promise you that. So yeah, just come check us out in the Banking with Billy Discord and ask me some questions, man. I got a lot of knowledge in here, in this big head I got. All right. And yeah, consider liking and subscribing. All right. Appreciate you. Thank you for watching.